Allergy shots, also known as allergen immunotherapy or subcutaneous immunotherapy, represent a cornerstone treatment for individuals struggling with challenging and persistent allergy symptoms. For many, seasonal sneezing fits, watery eyes, and endless congestion go far beyond minor irritations. These symptoms stem from the body's exaggerated immune reaction to harmless substances in the environment, such as pollen, dust mites, mold spores, or pet dander. For others, life outdoors holds a different kind of danger. Stings from bees, wasps, or hornets can trigger potentially life-threatening allergic responses. Allergy shots are designed to change the immune system's behavior, steering it away from overreaction and toward tolerance. But how exactly do allergy shots work their transformative magic? They function by exposing your body, little by little, to the very substances that spark your symptoms. Each dose is carefully measured and contains a small amount of the allergen. At the start, doses are extremely low, chosen to ensure safety and limit the chance of a strong reaction. Over time, the amount of allergen in the shots is increased, a process that takes place over weeks and months. This gradual escalation encourages your immune system to adapt and develop a greater tolerance. Instead of seeing the allergen as a threat and launching an all-out histamine battle, your body learns that the substance is relatively harmless. This immunological reprogramming lies at the heart of why allergy shots work. By the end of the treatment course, many people find that their bodies no longer react, or react much less severely, when exposed to the allergens that once tormented them. The development of this tolerance can also mean fewer symptoms, a reduced need for other medications, and in some cases, longer-lasting relief even after the shots end. The journey through allergen immunotherapy has distinct phases, each with its own timeline and expectations. It begins with the buildup phase. During this initial part of therapy, injections are typically given between 1 and 3 times per week. This phase lasts anywhere from 6 to 10 months, depending on the protocol your allergist decides is best for you. With every visit, the dose injected is incrementally increased. These gradual steps help your immune system adapt, reducing the risk of severe reactions. Reaching the optimal dose marks a turning point. This level, the maintenance dose, is where your body is exposed to the highest amount of allergen considered safe and effective. Once here, the next phase begins, the maintenance phase. At this point, the schedule shifts and injections are spaced further apart, usually about once a month. This phase extends over a number of years, most commonly between 3 and 5, although some people with severe allergies may continue for longer. Maintenance is key to reinforcing the immune system's newfound tolerance and ensuring lasting results. While the commitment in both time and routine can seem daunting, the benefits are often substantial. For most people, symptoms don't disappear overnight. However, improvement becomes noticeable within 6 to 12 months of beginning allergy shots. The vast majority, around 80%, experience meaningful relief from allergy symptoms, making the time investment worthwhile. Perhaps most encouraging, about 60% of individuals maintain this improved state, even after completing their course of shots. For these people, the impact can be life-changing. Enjoying springtime, being around pets, or mowing the lawn without fear of misery. However, like all medical treatments, allergy shots are not without risks. Since the therapy involves injecting allergens, there is always a chance of allergic reaction. Most frequently, reactions are mild, such as redness or swelling at the injection site, as well as itching, sneezing, congestion, or hives. These effects are common and typically resolve quickly. To ensure safety, healthcare providers monitor patients closely, usually asking them to remain at the office for about 30 minutes after each shot, especially during the buildup phase. This period allows medical staff to act promptly should a more serious reaction develop. Severe reactions, though rare, can occur. The most serious of these is anaphylaxis, a rapid and systemic allergic response that may involve difficulty breathing, a drop in blood pressure, or even loss of consciousness. Because of this risk, allergy shots are administered in controlled settings under the watchful eye of trained specialists equipped to manage emergencies. Fortunately, the vaccines are formulated to minimize such risks, and adherence to dosing schedules is paramount in maintaining safety. It's also important to know what allergies allergen immunotherapy can and cannot treat. Allergy shots are highly effective for airborne allergens, such as pollens, dust mites, molds, and animal dander, as well as for stinging insect allergies. However, they are not used for allergies to foods, medications, or latex. These conditions require different types of management, such as strict avoidance or other forms of therapy. If you are considering allergy shots, your allergist will conduct a thorough evaluation, potentially including skin or blood tests, to confirm your triggers and determine if you are a suitable candidate. In addition to their effectiveness and safety, cost is a practical factor to consider. Immunotherapy can be a significant investment. Annual costs typically range between $1,000 and $4,000, depending on factors like your geographical location, the healthcare provider you visit, and your specific insurance coverage. It's wise to discuss expenses with both your allergist and insurance provider ahead of time. Some health plans offer comprehensive coverage, while others may only cover a portion of the treatment cost or require higher copays for specialist visits. With several years of shots potentially required, understanding your out-of-pocket responsibility helps you plan realistically for your medical care. For those who decide to move forward with allergen immunotherapy, commitment, patience, and close collaboration with your allergist will be key ingredients in your success. Patients are expected to adhere to their shot schedule closely because missed doses can necessitate dose adjustments or even restarting a phase in the protocol. Keeping regular appointments also allows your healthcare provider to monitor your response and adjust your treatment for maximum safety and benefit. It's also beneficial to track your symptoms throughout your allergy journey. Keeping a journal can help you and your doctor gauge progress from month to month or season to season. Many people find that over time, their need for antihistamines, nasal sprays, and other symptom relief medications drops dramatically. Children and adults alike can enjoy improvements in sleep, focus, and daily comfort. Essential elements for a happier, more productive life. While allergy shots are not for everyone, they represent hope for those with allergies that persist despite standard medications or make daily living difficult. For asthma sufferers with related allergens, immunotherapy may even help control breathing symptoms. If you're someone whose quality of life is affected by allergies, or who can't easily avoid your triggers, discussing allergen immunotherapy with an allergy specialist might just be the first step toward lasting relief. In summary, allergy shots offer a systematic, science-backed way to retrain your immune system, reduce dependence on symptom-relieving medications, and significantly improve daily life. While the treatment demands time, commitment, and an upfront investment, its potential for lasting benefits makes allergen immunotherapy one of the most powerful tools in the fight against allergies. Before starting, balancing the practicalities of safety, potential side effects, and cost with the promise of long-term relief is essential. With expert guidance and a willingness to follow the program, you could find freedom from allergy symptoms and unlock a future of easier breathing and greater comfort in your everyday surroundings.